Hello, I'm Dr. Yash. Today, I want to take you through one of the most pressing health concerns of our time: diabetes. According to the World Health Organization, more than 422 million people worldwide are living with this condition. It's a chronic disease that develops when the pancreas can no longer produce insulin, or when the body is unable to use the insulin it makes effectively. Now, why is insulin so important? Insulin is the hormone that regulates our blood glucose. When insulin isn't working as it should, blood sugar levels rise, and over time, this can cause serious damage to our body's systems, especially the nerves and blood vessels. Let's understand this better. There are three main types of diabetes. Type 1 diabetes. This is an autoimmune condition where the body mistakenly attacks the insulin-producing beta cells in the pancreas. It's usually diagnosed in children and young adults. Though it only accounts for about 5 to 10% of cases, it requires daily insulin injections for management. Type 2 diabetes. This is by far the most common, making up about 90 to 95% of all cases. While it typically develops in adults over the age of 45, we are now seeing it more often in younger people, even adolescents. The good news is, type 2 diabetes can often be prevented through lifestyle choices like regular physical activity, a balanced diet, and maintaining a healthy body weight. Gestational diabetes. This form appears during pregnancy and usually goes away after childbirth. But both the mother and her child are at a higher risk of developing type 2 diabetes later in life. In the United States, it affects up to 10% of pregnancies every year. Now let's talk about the impact of diabetes. This condition is a major cause of blindness, kidney failure, heart attacks, stroke, and even lower limb amputations. In fact, in 2019 alone, diabetes was the direct cause of 1.5 million deaths worldwide. Cardiovascular disease affects nearly 1/3 of people with type 2 diabetes, and kidney damage is seen in 20 to 40% of patients. But here's the important part. While the complications can sound alarming, many of them are preventable with the right management. Controlling blood glucose, blood pressure, and cholesterol levels is absolutely critical, and that's where education comes in. Knowledge is power. Studies show that diabetic patients who truly understand their condition can lower their long-term blood sugar levels, HbA1c, by as much as 1%. That may sound small, but it makes a huge difference in reducing the risk of complications. So, what does living with diabetes require? A proactive approach. This means regular checkups, ideally every 3 months, or more often if your sugar levels aren't stable. It means continuous glucose monitoring, as well as routine eye and foot checks. That's exactly what this ebook is designed to do: empower you. You'll find practical guidance on diet, medication, exercise, and lifestyle habits that will help you not just manage diabetes, but live fully and vibrantly with it. Remember, diabetes doesn't have to define who you are. With the right knowledge and support, you can take charge of your health and live a meaningful, fulfilling life.